So Loncastuximab tesirine is an antibody-drug conjugate targeting CD19 in lymphoma cells. It is conjugated with a payload, which is a pyrrolobenzodiazepine, basically inducing interstrand crosslinks, so DNA damage in target cells. The LOTIS-2 study demonstrated activity in relapsed refractory Hodgkin lymphoma with 25% complete remission rate in heavily pretreated patients. And now Loncastuximab tesirine is indicated for third-line plus diffuse large B-cell lymphoma patients. So there are few side effects which are related to the payload, the pyrrolobenzodiazepine, that require attention. So the first one is edema and effusions that can be prevented by using a steroid premedication and by giving patient basically diuretics such as spironolactone or similar diuretics. And one important advice is that during therapy the patient should really weight themselves on a daily basis in order to catch weight increase, and so really start in advance the treatment for effusions or edema. And the second side effect would be phototoxicity, also related to the pyrrolobenzodiazepine payload. So the main advice here is really to avoid sun exposure. And if a rash basically shows up, you can give topical steroids or very emollients, or basically be very careful in avoiding sun exposure. And sometimes this photosensitivity can last a few months after the completion of Lonca therapy. And third, one important side effect would be elevated GGT liver enzyme that can be observed, but this actually happens without any evidence of liver damage. So it's really important to exclude other causes of elevated liver enzymes, such as hepatitis reactivation or exposure to certain medicine drugs that can impact liver function. But I would say that per se elevated GGT should not be really something that would prevent you to deliver this treatment to patients.